welcome to Dustin's Kaleidoscope. I am Dustin, and I am here today with Dr. Ernest Rogers, who is a general practitioner, veterinarian, and you are the owner of the Maplewood Animal Hospital in Maplewood.
In Maplewood, yes.
Thank you so much for being here.
No problem.
So, first of all, you're a veterinarian, so that means that you obviously treat animals. But can you describe the types of animals? Is it mostly domestic animals, or are we talking about larger animals like cows and horses and things like that?
Well, there are a lot of veterinarians, and many of us have different areas of interest. My area of interest is dogs and cats, but I will see snakes, and I have seen some birds, and I have seen some what we call pocket pets, gerbils, hamsters, guinea pigs. But I'm very allergic to guinea pigs and pocket pets.
Really?
And I don't have as much experience with birds as I would like, so I tend to do just the basics for those animals. But for dogs and cats, we tend to do medicine, dentistry, and surgery. And that's our educational background, is in all those three areas. To support those three areas, we also do diagnostics and treatment. So, you know, and right now we're more concerned with prevention.
Okay.
Prevention of disease and regular examinations. And so I think we're going to be getting into that a little later.
Yes, we are going to get into that. In fact, we came to your office, to your hospital, and we went through a very abbreviated exam for a dog that was going to be neutered. But before we get to that, you mentioned the prevention part of it. So one of the reasons why I wanted you to come on was because I know that this time of the year, graduations, birthdays, different things like that, people tend to get their children pets. They, all types of reasons to get a pet. And so I wanted to go over some of the basic things that, an owner or prospective owner should be looking for as far as a healthy pet, and also, the types of pets that are best for the family and the child and just in general.
And often it's difficult when you pick up a puppy or a kitten to be able to tell whether they're healthy and they're going to be fine or whether they have problems. So my recommendation, within 24 hours of getting these pets, bring them to the veterinarian so he can examine them, listen to their heart, look in their mouth, make sure there isn't a cleft palate, make sure that everything else is working well. And that's really a medical intervention that can't be accomplished by the owners. However, when you're picking out a young animal, you look for the one that's active. You look for the one that doesn't have any obvious defects, like if one's missing a foot. It's not that it won't make a good pet, but bring it to the veterinarian to make sure there aren't other associated problems. Okay. Most animals, when you get them, of course, need vaccines, just like most children need vaccines. And so we usually start vaccines between 6 and 8 weeks. There's a series of 3 vaccines for the core vaccines. And the core vaccines, of course, are distemper combination vaccine, a Bordetella or kennel cough vaccine, and at 12 weeks we can give rabies. And the most common misinterpretation of these events are, I have people coming in with a 7-month-old dog that's never been vaccinated. That dog has been susceptible to parvo, which is part of the distemper vaccine. And parvovirus is a disease they can pick up outside, especially if they go in parks where other dogs have been. And basically what happens is they poop out their intestines because the virus attacks the inside of their intestines. So vaccines, though some people think there is a risk, and certainly with some vaccines and some animals there will be a risk, that risk is so minimal as to negate the need or support the need for that vaccine. So when you look at a risk of a vaccine versus the benefit of a vaccine, you're much wiser to get the benefit and have the vaccine.
Okay, so since you started on that, you know what I'm going to do? I'm going to have us look at the clip of you doing a very abbreviated examination in your hospital. So we will be back in a moment, and when we come back we can discuss everything that we've seen in the video. All right, Dr. Rogers, thanks for having us here today. Exactly what are you going to show us?
Okay, so what we're going to talk about today is how we as veterinarians interact with the client to give them the basic information about what their pet needs. Spay, neutering, microchip, the health concerns with vaccines, and Mr. Fallis, who is our resident, client, is coming in this morning with his dog to have it neutered or spayed. And so what we'll do is we'll just go over the exam and show you what I do when I talk to my clients.
Okay, great, thank you. All right,
do it.
You ready?
All right.
Come on in, Mr. Fowler.
Thank you.
Why don't you have a seat and let me just examine little Vanilla.
All right.
Now tell me about Vanilla. Vanilla is a female dog.
Yes.
And how old is she?
She's 7 months now.
7 months, and we discussed earlier when she was in before
Yes.
how we like to spay most dogs between 6 and 9 months.
Yeah,
Now there is
that's
some controversy about that, but in general, we prefer to spay them for several reasons. One is they tend not to come into heat. And that's good because when they come into heat, they want to go look for a boyfriend.
Yes.
So it's very hard to keep them in the yard and with kids, the door opening, they always want to get out. The majority of dogs I see that have been hit by a car are either boys that haven't been neutered or girls that haven't been spayed. And so those are the problems that we see with spaying. There is some controversy about whether we should spay them early or later. One of the problems of spaying them later is that we often have an infection of the uterus called a pyometra. So today, Vanilla, you're not happy about this, are you?
She's gonna be okay.
Today, Vanilla is coming in to be spayed and to be given a microchip, which is another method of identifying the animal. You can't track the animal with a microchip, but you can certainly identify him once he's found.
Sure.
So let's start off by giving him, this is called a PreSurgical Exam, and this is just to make sure that the animal is healthy enough to go through anesthesia and the surgery.
All right.
So we'll do that. So Mr. Fallis is here. We got this dog. Let's get going.
All right.
Right.
It's all yours.
Hey Vanilla, how are you? Oh baby, it's okay, I'm not gonna hurt you. Okay, so when we do an exam, we generally we use 4 of our senses. We use touch, we use hearing, we use sight, and we use smell. So when I do an exam on a dog, I start off by looking at their teeth, and this dog, if you can get a close-up later, this dog has an extra tooth which we'll take out.
Mm-hmm.
That one should
Yeah,
really
yeah,
just
yeah.
come out with that, but since it's not there, we might consider just taking that out. Then smell the breath, make sure there's nothing bad going on. You're so quiet, oh poor baby. Look at the eyes, make sure they're nice and clear and bright. The nose, now the temperature of the nose has nothing to do with the health of the dog. Cold nose does not mean a healthy dog. Wet nose does not mean a healthy dog. It's just a factor that's an old wives' tale. So I look at the nose to make sure there's no discharge, look at the eyes to make sure there's no discharge, redness, or cloudiness in the eyes. I look at the ears, and now these ears have quite a bit of fur in them, so under anesthesia we'll cut some of this fur away.
Okay.
And the reason for that is because the cerumen or the wax will get caught in the ear, grow bacteria, and we'll have ear problems. So either I or the groomer will keep that hair short. Then I feel the dog to make sure there's no lumps and bumps. Now this is a young dog, so we wouldn't expect to find any lumps and bumps. Sometimes we find one in the belly area because there's a hernia. But beyond that, there doesn't seem to be any lumps or bumps. Check to make sure she's not in heat. And then I take my stethoscope, and this is the part where I listen. I listen to her heart to make sure it's normal beating.
Okay.
Whoops, baby. And so that's all normal. The last thing I do, easy baby, is just feel their belly to make sure that there's no lumps or bumps in their belly. I also listen to the belly to make sure that the intestines are working. So this is a nice healthy little puppy that is going to be spayed today, and she'll go home tomorrow morning.
Okay, so that was a basic exam. You had a very cute dog in there,
Right.
a puppy actually.
It was a puppy.
And you talked about the whole, the different things that you look for as a vet. The ears, the eyes, the smell. You even talked about the nose and whether
Right.
the temperature doesn't matter.
Right.
So after doing all of these things, whether once you've neutered your puppy, after that, and you bring the dog home, you mentioned that I know you have there the microchip.
Right.
Once you've inserted that, is there any, does the dog have, or the puppy, should the dog say, less mobile, more mobile? I mean, what kind of activity are you looking for?
Well, if we can go back to the exam, first of all,
Okay.
that was Vanilla,
Yes.
who was one of my cute little patients. And as with most young animals, we recommend neutering. And neutering means a spay in a female animal and a castration in a male animal. And there's some controversy over when we do that, but in general, the benefit of those procedures outweighs the risk of having your dog try and run out of the house and get hit by a car,
Right.
or have an infection in their uterus, or if it's a male and long-term, end up with prostate problems. So that's why we do the spay and neutering. Following that, and that's often, I like to do it someplace between 6 and 9 months. Some people can do it later. But once we get the dog and we've spayed them, the spay is a little bit different than a neutering. To do the spay, we have to actually go into the abdomen, identify the ovaries, remove the ovaries and part of the uterus. So that's a major surgery. We've opened up a body cavity and we sew it back together, but just like anything else, no sewing job is 100% if the animal's going to stretch and sprint and jump and play. So we ask that the owner keep them quiet for at least 2 weeks after the surgery. For a neutering in a male dog, which is a castration, we don't open up a body cavity. We still ask them to keep the animal quiet because we don't want the stitches coming out.
Okay.
So in the long term, we do the spay, we do the neutering. We often recheck the animal at the owner's convenience. And after that, the first year, we have them on heartworm pills as prevention. We have them on flea and tick as prevention.
Okay. And what are heartworm? I know what flea and tick. but
Heartworms is a disease spread by mosquitoes. Not all mosquitoes are infected, but the ones that bite your dog put a parasite under the skin. That parasite eventually makes its way to the blood, and once it's in the blood, can make its way to the heart, and actually prevents or starts forming worms. And these worms are like spaghetti in the heart, and obviously it doesn't allow the heart to function very well. And so the treatment for this is almost as bad as the disease, so we always recommend that the animal be put on a preventative, a tablet once a month. And as long as we've tested it and it doesn't have the disease, we put it on this tablet and we go from there. Normally an animal is unlikely to get heartworm disease, but the tablet ensures that. And as I said, the disease is almost as bad as the treatment, so that's why we want the preventative.
And you would give heartworm medicine to both dogs and cats?
Heartworm medicine to dogs. I don't know of any heartworm medicine for cats, but heartworm can be an issue in cats as well.
Okay.
Flea and tick medicine is to prevent different tick-borne diseases, and that includes Lyme, Ehrlichia, Rocky Mountain spotted fever,
Okay.
Anaplasma, and they can also cause devastation with the kidney, liver, and lungs.
Okay. Okay.
So those are two preventative things that we recommend.
Okay, so we have just a few moments, so we're going to actually come back after the break, and I want you to tell us a little bit more. Show us some of the things that you have.
Okay.
And we'll talk about that. So this is Dustin's Kaleidoscope, and we'll be back in a moment.
Local government, local educational institutions, and local community members all use cable access TV to communicate their message. They depend upon it as an affordable means of outreach. Public educational and government access television empowers local government agencies, individuals, and groups to use the media to speak directly to their constituents in a more direct and cost-effective way. Make sure everyone has a voice. Support your local PEG channels.
Welcome back. I'm Dustin, and I am here with Dr. Ernest Rogers. Thanks again for being here. I see you have some things that you obviously use with the dogs.
Right, right.
So what do you have there?
Okay, well, to prevent a dog from being unidentifiable, because if you see 3 German Shepherds in a row, even though you know your dog, it might be hard to identify that dog. So if that dog's stolen, run away, you want to be able to identify your dog definitively. And the way we do that in dogs, even in cattle and horses and cats, is we apply something called a microchip. And this is what a microchip looks like. And what it is a long needle with what's the equivalent of a grain of rice with a radio transmitter in it.
Okay.
Now I want to make it clear, this radio transmitter only gives up a signal when it's pinged, or when you identify it using a transponder, or in this case, this is a locator,
Okay.
only for the microchip. I want to make it clear because many people don't understand this, and that is that a microchip in the skin of the dog can't be identified except by X-ray, and so no one is going to be able to take it out. number one. Number two, you cannot track your dog's location with this. This is only for identification. And so what happens is I put it under the skin using this needle. It's a fairly big needle, but we do it without anesthesia. It's a needle about the same size as what you'd use to give blood when you go to the Red Cross to give blood.
Oh, okay.
We put it under the skin, and this little piece of grain of rice, essentially a grain of rice, will remain under the skin. It's been specifically designed so it won't migrate. It stays, usually we put it between the shoulder blades or at the bottom of the neck, at the base of the neck and the back, and it stays there. So what happens would be, if for some reason your animal is lost, we then take our scanner and we scan over the animal, and this gives us a number. That number is then used when we call the company that logs all these numbers, and they will tell us who the owner is.
Okay.
But I have to tell you, at least in my clinic, if you get a microchip, you fill out the paperwork, we send it in. I've had way too many instances where animals have come in, they had a microchip, they were badly injured, on death's door in fact, and we were unable to find the owner to find out if they wanted to go ahead with treatment or euthanize. And clearly if an animal is badly injured and severe pain, we often have the option of euthanizing him or her, and that often happens. So the microchip is valuable, but only if the owners fill out the paperwork, send it in, and it's identified by the company as to who the owner is.
And again, it's not if a dog is lost and you're looking for your dog, and that's not like a scanner that locates. It's not a GPS thing.
This is not a GPS.
You have to physically have the animal there, and then you would scan it with that instrument.
This is not a GPS. It will not locate your animal once it's lost. However, I know several telephone companies do have, and on the internet there are several issues where, or companies that make something you can put on the dog's neck or on the collar, and you can track it with your smartphone.
Okay.
The issue with that, if a dog or cat loses their collar, if someone finds your dog and takes off the collar, you're not going to be able to track it. Right. But that's still an option for people who want to know where their dog is once it's left the house or the yard.
Right.
So again, neutering and spaying your animals will help reduce that tendency to want to leave the yard and find a boyfriend or girlfriend.
Because that's pretty much the main reason why they would want to
That's
go
a
out.
lot of the reasons. Some dogs just like to escape.
To
Some
explore.
dogs are curious. Some dogs just want to go across the street and say hi to their friends. And so it's an issue where you really want to make sure that your dog is secure. And I have always thought that a microchip was the best way to go. And my dog does have a microchip.
And so when you insert the microchip, it stays in for the lifetime of the dog.
For the lifetime of the dog.
Okay.
No one would know it was there. There have been instances of cruelty where people have been able to figure out that it's there and they try and cut it out. But that's not common, and you'd really have to be skilled to know that it was there. Usually the only way we can identify it is on an x-ray.
Okay. All right. So I also wanted to mention some of the common diseases that pet owners should be aware of, or at least be looking for, if they find something odd or unusual in their pets.
Well, if we start with the young dog, the puppy, or the young cat, the kitten, we often find that some of the common diseases can actually be parasites. So one of the parasites, as we already discussed, was heartworm, and that's inside the body in the heart. Another disease that we often see in animals is worms in the poop. Two completely different parasites. When I take blood, I'm looking for heartworms. When I gather poop, I'm looking for parasites in the intestines. And there are three basic parasites that are most common: roundworm, hookworm, and whipworm. And the issue with this is not so much for the dog. The dog will have off and on diarrhea, may have a little blood in the stool. Certainly we don't want that for our pets, our furry pets. But the more common issue is that some of these can be transmitted to humans. Particularly roundworms can be transmitted to young humans, because young humans and crawling around, or even young, a little older than that, they don't tend to wash their hands. So if a dog poops someplace, and even though it's cleaned up, if it hasn't been cleaned up completely, and they get poop on their hands, and then they put their fingers in their mouth, they can acquire that parasite. And those parasites have been known to cause blindness and liver disease and mental retardation. So the issue is a public health issue with the fecal parasites. And so that's one thing that we look at for the puppies. And when you buy a puppy, if it has diarrhea, or even if it doesn't, bring the poop into your veterinarian so he can examine it. The next issue...
You don't mean in general, or do you?
I mean, if you get a puppy, you should bring the poop in. And it's a good habit, no matter what the day, no matter what the age of the puppy or the cat, always gather poop when you go in to see your veterinarian. If it's an issue that can be resolved by analyzing the poop, then that's what we'll do. If it isn't, we throw it out. It's no big deal. It's a pretty cheap commodity. Then from there, it's obviously vaccines, and we already talked about some of those. After vaccines, it's spay and neutering. And then after that, once your dog is healthy and we know, or a cat is healthy, and we know it's moving along well and growing at the proper rate, then some of the more common things we see are deformities in the legs. And that might be because of the breeding, because of accidents. It can certainly be because the animal is developing at different rates. And so what I recommend in very large dogs is don't use only puppy food or only kitten food. Try and mix it with well, cats is not as much of an issue as large dogs. I'm talking large breed dogs, Doberman, German Shepherds, Mastiffs. I usually recommend to my clients that we use a little bit of adult food in with the puppy food so they don't grow too quickly. The joints don't necessarily grow as fast as the long bones, and so you can develop some kind of orthopedic problems because of that.
So so by mixing in adult food, it would prevent the
Well,
bone
you're
from-
giving less of the growth factors,
Got it,
the
okay.
protein and the high fat that would be available to the puppy if he only had puppy food.
Okay.
After that, we start looking for things like intestinal problems. Sometimes they have off and on diarrhea. Both dogs and cats love to drink out of puddles, and they can pick up giardia, which is another intestinal parasite. They like to chew on wood. They like to chew on stones and rocks. And we see as animals are growing up and they're a little bit older, we see that all kinds of weird and wonderful things in their intestines based on x-rays. There's a contest in one of the veterinary journals that has shown knives and pantyhose and rocks.
Really?
So we're concerned as they grow up that they be properly trained. When they're teething, they should be given the appropriate toys to chew on, and don't chew on your owner's $7,000 Minogue Leblonics shoes. I mean, it's just not appropriate. So training, after we've gotten everything else done, training is an essential part of keeping these animals healthy. Making sure they can come, sit, stay, and make sure that they eat when they want to eat, but you can take food away from them. If they pick up a bone, you should be able to go in there and take that out of his or her mouth.
Okay.
So with puppies, that's much easier than it is with cats because they're a little bit faster. Once they're middle age, I say over the age of 5 or 6, I really like to do blood work on them on a regular every 2-year basis. Some of the diseases like kidney disease, thyroid disease in cats and dogs, liver disease, we can't really pick up simply by doing a physical exam. So blood work around the age of 5 or 6 every other year, and then when they start turning 8 or 9, depending on the breed of the dog, every year, so that we have a baseline as to what's going on. And as some of these values start to creep up, we can then see it because we have 2 previous bloodlines,
Right.
2 previous blood analysis to be able to tell.
So what if your cat or dog is very lethargic and gains a lot of weight and it just seems unusual? I mean, are there just some animals that are big and just could that just be a common trait?
It can be, but what I say to my clients, if you have a concern, bring it in and see me. There's no rule of thumb to say that if your dog gains weight, as mine has, and I call her chunky now because she's gained about 20 pounds or 10 pounds. There's no rule of thumb to say if your dog is a little bit fatter, there's a medical problem. There's no rule of thumb to say that if your dog is bleeding from the mouth, it's a medical problem. Especially if you know your dog's been chewing on bones or chewing on sticks, there could be a little bit of blood. Younger dogs will often have blood in the mouth because they're losing teeth. So there's no rule of thumb. If you don't know and you're not sure, my recommendation is, at the very least, call your veterinarian. And of course, to my clients, I'm available on the email. So they not email.
Facebook or?
No, I'm available through. I guess it's email to my hospital.
Okay.
So if they have a question, they can ask. Sometimes I can tell and I can say, yeah, it seems like it's pretty normal for the age and breed of your dog, or I'm not sure, you have to bring it in.
Okay. Okay. So those are just some of the types of things that pet owners should look for. We only have a couple of minutes, but I wanted to talk very briefly about looking for the temperament, like what kind of temperament should you be looking for as far as like adding a member of your, the family,
Right.
adding a pet to your family.
So behavior is part of the training facility, part of the training direction that you have to do with your animals. One of the problems with picking out a dog is don't pick out a Chihuahua if you're going to be running 2 miles a day. I mean, but people do this. They say, oh, I want a little lap dog, but they end up buying a bull mastiff. And a bull mastiff, when it's grown and it's 100 pounds, is not going to be a very good lap dog. So, I mean, consideration for how this dog is going to fit into your lifestyle is important.
Okay.
Certainly one-person dogs are not good to have if you have a large family or lots of friends that come over. And all these are breed temperaments that you can discuss with the breeder and get some insight into. But certainly there's no rule of thumb. Again, medicine is not that easy. So there's no real rule of thumb that you can say, this animal is this breed, therefore I'm going to expect it to do this.
So what if you get a dog or a cat from the, let's talk about dogs because we're talking about that.
Okay.
Yeah, what if we get one from the Humane Society and you don't really know what the breed is, so you can't say, oh, this is a full bred like Mastiff, so this is this is the bigger dog. So what would you suggest to people then?
Well, often you have to have it evaluated. Again, the person to evaluate that dog would be your veterinarian. Okay. Certainly there are people who can evaluate it as well. There are some people who do behavior at St. Hubert's. I always recommend my clients to go to PetSmart, not because they're so exceptional, but because they're all trained well and they're trained in their discipline. They don't go beyond that. So the assessment of the dog can be done in multiple different ways. But obviously, picking a dog from a shelter, sometimes we run into problems because they have previous problems. That's why they were given up.
I see.
So you have to right away, within 24 hours, bring them to your veterinarian for assessment.
Okay, so it sounds like the bottom line, if you had to sum up everything about getting a pet, because we have about 10 seconds, you want to make sure you get the vaccines, you want to make sure your dog is neutered. Even before that, you want to make sure that the dog goes to a
See your veterinarian early and he can guide you through all the problems.
That's basically it. Thank you so much for being here, Dr. Rogers. I'd like to have you on again so that we can follow up maybe with older dogs. But this is Dustin's Kaleidoscope, and we will see you next time.